Morning, everyone. Thank you for joining us. I want to talk a little bit about Aetna, the brand. And first of all, how many people in this room have Aetna insurance or Aetna members? Okay. So everybody's sitting on this side. That's funny how that worked out. Well, thank you for being Aetna members. Hopefully you're happy Aetna members. And we're going to talk a little bit about that because our industry is in transition from an industry focused on the B2B universe to the direct-to-consumer universe. And the transition that we have to go through as a brand to make that work is phenomenal, and we'll talk a little bit about that. Very briefly, we all start every presentation at Aetna with our Aetna Way Values Wheel. All of our 35,000 employees have essentially memorized the elements of this values wheel. It drives our decision-making, our product development, our brand work, everything we do. We put the people who use our services at the center of what we do. And that is the sort of essence of the complexity of our challenge as a brand, as a firm, when we go to the next level. Quickly, we were founded in 1853, which by coincidence is when my house was built. And I've spent the winter lamenting that fact. We have to get a new roof, new gutters, new siding, you name it. Anyone else who's been through the New England winter this year probably has to do the same. We're down in Hartford, and we are the third largest health insurance brand, health insurance company in the country. And as you can see from the bottom, we have several Boston, New England area members, customers, including Fidelity and CVS, two companies that I've worked with closely in the past and have a lot of respect for, as well as Staples, BJ's, Liberty Mutual, and a lot of others. We also have a lot of the colleges and universities in town. We have prided ourselves on our ability to develop products and services directly aimed at the consumer. And with 19 million members, that may sound interesting. You know, wouldn't you think you'd do that as a matter of course? Well, actually not in the past. We have always been a wholesale brand, wholesale company. We sold to the Fidelities and CVS's of the world, where a single benefits manager or benefits manager group bought on behalf of the employees. So our customers have always been the company, not the employees. And as we've, in the past few years, have built out our products and services, we've been increasingly focused on the consumer. We created the first consumer-directed health plans. We created a personal health record. For those of you who have a personal health record and use one, it's an electronic connection to all of your medical records, so if you move from doctor to doctor, you're no longer carting paper around with you. And we were the first to bring out health savings accounts linked to your CDHP. The Aetna brand promise on the right is built on our values and our enterprise strategy, and this is new. This is hot off the presses, basically. We've been working with Siegel & Gale, our brand consulting firm, and as well as Arnold. And we just brought Belinda Lang. Belinda, you want to stand up? Belinda Lang just joined us from American Express. So all of this is part of the repositioning and relaunch of the Aetna brand. Bringing in consulting expertise and Belinda to help us do this, where we have basically put ourselves in a position of reaching out to consumers and putting the power of health in their hands. And we'll talk a little bit about what that means. Also talk today about all of the other brand levers, as I call them. And when I joined the company, my background is primarily in communications and brand management from the perspective of reputation management and research, public affairs and such. I had run research and advertising campaigns or had research and advertising agencies underneath me before, but never had been responsible for this level of commitment on the marketing side. So this has been a great learning experience for me, and it's been a lot of fun. But honestly, we're building it from scratch. Going from B2B to B2B2C is a huge transition. And just as a matter of example, we're a $35 billion company with 34,000 employees and 38 million customers that we serve. We did not have a customer relationship management system. We didn't have a platform. To me, that's shocking. To you, it might not be. But to me, that was the indication of how big a switch we had to make. And the investments we're making in marketing precision are part of it. But the first thing I did when I got there was figure out that we needed to create a new member experience. you know, when your customer is the company and not the individual, not the member, everything you do is built for or designed for the company. So our consumer-directed health plans, even though they're called consumer-directed, when they originated 10 years ago, were really originated with the interest of the plan sponsor in mind. What was the best plan designed to serve their needs? Nothing wrong with that. It's just that if you're selling now to the consumer, you have to reorient that. You have to turn the telescope around. So a lot of what we've been trying to do in the past since I've been there, I got there about 4.5 years ago, is to recreate the member experience. And you know, we are bound and determined to have the single best member experience of any company in our space. And we're working hard on that. And one of the keys to that is to simplify our offerings. Our products and services are way too complicated. For those of you who have health insurance products, and I'm sure everyone in this room does, and you're lucky compared to those who don't, they are complicated, and the names and the nomenclature, the branding, the way products are designed, the way the websites work, it's not as simple as it is in the retail or financial services experience, and we're moving fast to catch up with that. The last part, of course, is advertising. We have done a lot of advertising in the Medicare and individual market over the years, but it really let our brand basically go dark for several years, which even though we have the strongest brand in the space, is a huge mistake, and one which we are correcting as soon as we can. We have for those of you who are marketing scientists, have a pretty simplistic but increasingly important, and as we're layering on complexity, approach to segmentation. And again, it's both for B2B, so we'll segment the student health market between Ivy League schools, big state colleges, local colleges. We'll segment in the B2B space, women-led firms, professional services firms, labor-dominated manufacturing firms. And on the individual side, on the consumer side, we've got a lot of work to do to figure out how we can go after the right kind of customer for each of our business lines. And the interesting thing about this space is, though all of us are consumers and all of us are health plan members, because someone else bought it for you, there's a disconnect between you and your insurer. You didn't choose Aetna Insurance for the most part. Your employer did. So closing that gap is a big part of what we're trying to do. Getting you to be more closely associated with that purchasing decision and getting us to be more familiar with what your needs and wants are. And that is driving a lot of the work we're doing. I just talked briefly about CRM. We're building the platform at considerable expense. When you think about 39 million members, you think about B2B, you think about numerous product lines and different services. It is a complex model. But the basic point is we're going to be trying to drive every interaction with with our members across all our business lines, whether they come to us through the phone, on the internet, however they purchase our products or utilize our products, to make sure we're capturing that information and using it not only for marketing purposes, acquisition and retention, but also for engagement. And that's critically important, because our job, whether it's on behalf of your employer or on your behalf, is to make sure that you have the tools and information and support you need to utilize your health benefits properly. And that's a big deal in this country. I think everyone knows how much trouble we're in as a country now because of the cost of health care and the fact that it's out of control and that we're unable to afford long-term commitments we've made as a country unless we get the cost of health care and the utilization of health care under control. And the point is there that if someone else was always buying your health insurance for you and paying for your health care, you had little reason to worry about what it costs. And there's nothing wrong with that unless the problem that has taken place in this country actually occurred, which is that because the consumer of health care is not the payer of health care, that disconnect has led to a lot of overutilization or improper utilization. And I'll give you some examples. You've got the best healthcare system in the world in this town. And it's a different market here because it's primarily controlled by the not-for-profit Blues plans and others. But it's no different than any other market in one sense, is that if you get an MRI, you can get one a mile and a half from here for $800, and you can get one 3 miles from here for $1,200. So that $400 would be, if it was out of your pocket, that would be a big deal. Would you go an extra mile and a half out of your way to save that kind of money? Of course you would. But under the healthcare system we have now, you would never know that there was a difference in price. Healthcare now is it's like walking into a store and loading your cart up. None of the shelves are organized. There's no signs anywhere. You load up you spend all day finding what you need. You load your cart up, you get to the cash register. They take your credit card, but there's no prices on anything. They don't tell you what it costs. When you leave, they don't give you a bill to sign. You have no idea. You get the bill 6 months later, and you don't know what your employer paid, what Aetna paid, and what you have to pay. So for obvious reasons, our healthcare system hasn't worked as a consumer marketplace, but that's changing quickly. And just to finish this section, if we do our job right and we gather all the data and get people engaged in their health and wellness and thinking about their plan, thinking about the information we provide them, and being able to access the information quickly and conveniently like they do in financial services or any other area of their lives, they'll use the Aetna services more effectively, and they'll get more satisfaction out of them. The member experience we define simply as basically every touch point that we have, whether it's calling into the 800 number, going on a navigator, our website for our members, or using the products and services, every opportunity, every touch point is an opportunity to educate, engage, and inform. And just to give you an example of the broadness of what we're talking about here, member communications has been a sore point in our industry for a long time. You know, if you're trying to communicate with 38 million people, who all of whom have different plans, it's all run. Nobody actually writes a letter. Computers put all this together, and we know what happens when computers are in charge of communicating with people. This is a before and after. This is, thank God, the before. But you can't read that on the screen, but also if I printed it out and handed it to you, you'd have no idea what it said anyway. So now we hired Siegel and Gale, who, in addition to their brand consulting work, also specializes in simplification. And they've designed a whole new system for us to communicate with our members. And it's going to take us a while to drive it across our business and to change the thousands and thousands of letters and communications we have with members. But we're getting to the point now where you can actually understand what it is we're trying to tell you, which would be nice, wouldn't it? I'll quickly move through this section, the differentiated brand experience, until we get to the sort of the meat of it. But easy access is important. I said earlier that, you know, because we designed everything for the plan sponsor and the end user was the member, and we only sort of re-engineered things after the fact. One of the biggest things we've done, the biggest breakthroughs we've had as a company in the past few years, is our mobile tools and our access on your BlackBerry or your iPhone or your Android. We have the ability to get you to your plan and your information, everything you need, from your mobile tools. Now, that sounds like, well, of course anybody can do that. Iggy's Bread probably has a mobile app. In our business, that was huge. If you think about it, everyone in this room who has insurance, even if you were all Aetna members, chances are, unless you're at the same company, you'd all have different plans. You'd have unique plans. You'd have a different network of hospitals and doctors. You'd have different co-pays. You'd have different co-insurance. So our ability to create the technology that allows you to come in at your convenience, get into your specific plan, and find out your specific information was a huge breakthrough and a massive investment on our part. But we realized that if we wanted to be able to engage the consumer individually, one-on-one, in real time, in their plan to give them useful information, we had to make those investments, and we've done that. And the number of downloads on this has been phenomenal, and I can't remember the detail from the research that we did. But we've been pushing all these tools in an ad campaign that I'll show you in a minute. And by far, our mobile apps score higher than anything else we're trying to do. So it just shows you that it's not about the bells and whistles, it's about the convenience. It's about having that information next to you. We're trying to get people to make informed decisions. What does that mean? Earlier, the example I gave about MRIs costing as much as the differentiation in cost. This is This is the beginning of something huge for us, which is giving you the ability to find out real time exactly what something's going to cost you out of pocket, a procedure that you're going to have. And to give you an example, I'll come back to it in a second. This is part of Optimal Health. We created a whole new set of tools and services. And for those of you who are Aetna members, you should go check them out on Navigator, Smart Source, and Plan for Your Health and others. And we've created Ask Ann, our avatar who is on Navigator that helps people. She figures out when you're stuck and can help you answer a question, get the information, all of which is about convenience. But back to the cost issues. I'm sorry, this is our Navigator redesign, where we basically overhaul all of our web assets in the past 2 years, and this was sort of the crown jewel, which is Aetna.com, which is the #1 website in our industry, for good reason. It's by far the best in terms of usability and navigation. And of course, that's my opinion, but I'm pretty sure about it, right? On the mobile apps, we have some stats here that everyone's familiar with. But you can find a doctor you're looking for. You can also find the nearest CVS that has the drug you're looking for. All of which is fairly straightforward, but people love it. The part that's not straightforward, that's not so easy, is this. And transparency is a huge issue in healthcare. I talked about the MRI example. This is a colonoscopy, and looking around the room, only a few of us are worried about this at this point. But colonoscopies are interesting because everyone at some point has to have one. You reach the magic age of 50. Right after, you get a note from Aetna that says, go get one. You see your doctor who looks at your date of birth and says, oh, you're close to 50. You need a colonoscopy. Just a fact of life. The problem with that is that the price ranges are huge. The spread is huge. And before we created this tool, our members had no way of knowing that. Doctor wouldn't tell them. Hospital wouldn't tell them. So as Aetna members, they now can go in and get a huge range, but this happens to be 3, that tells you the price differentials, and you can choose. You can see from this example, you probably can't read it, but that's $287, and I'm not sure about you, but I don't think I'd go for that one. And that one's $1,064. So somewhere in the middle, there's a deal, right? A 4-to-1, 5-to-1 ratio. I'm not sure what you get for $1,000 with a colonoscopy, but. The fact that anybody, people drive 10 miles to a Walmart to save $20 on a cart full of groceries. Why they wouldn't drive 2 miles to save $600 or $800 in this case is beyond me. But the reason is because they don't know it. That's one reason. The second reason is because they don't feel like it's out of their pocket. But guess what? It is out of your pocket. It is out of your pocket. 100% of your health insurance costs are out of your pocket, not 80% or 20%, 100%. It's all pre-tax income. Your employer considers it compensation, considers it your compensation. Now, your co-pays, your co-insurance, all of that stuff comes out of your real pocket in your mind. So over the years, employers have pushed more and more financial responsibility onto their employees for 2 reasons. Mainly the fact that healthcare costs are out of control and people are having difficulty providing healthcare benefits to their employees. The second reason, though, is they want them to be more engaged and think about it financially and think about it like they think about anything else, purchasing anything else. But my problem was that, the tools, we weren't giving our customers, our consumers, the tools and information they needed to think and act like consumers. So our entire brand positioning and all the work we're doing as a brand is to drive towards this, to make sure that people have the tools and information and support they need to make the decisions they need to make. And this is the first iteration of this tool. It gives you the accurate information right out of your plan. It's the only one in the industry that actually works out of your specific plan. Because again, they're all unique, and most of them just give estimates or ranges. As we move towards the consumer space, we've got a 160-year-old brand that is very widely known and highly regarded, held in high esteem, which is a terrific foundation to make the transition to the consumer space. But we've got to make our brand relevant to consumers and figure out how to make it a compelling brand that somebody you want to do business with. And And a lot of the work that we're doing in this area is all all meant to drive towards that.
This is Wendy. Wendy is a big fan of Aetna Mobile because life takes Wendy places, and life takes her family places.
Hi, Mom.
So knowing she can find in-network doctors and pharmacies whenever or wherever she needs them directly from her mobile phone is important to Wendy. Where to next, Wendy? No more, get better. Get a smarter health plan. Aetna.com.
This was, in effect, a preemptive strike. And there's one more ad in the series that I'll show you. These were our first ads, basically ever, aimed at consumers. And Arnold did these ads for us, and we think they're terrific. We wanted to begin to reposition the brand more as a consumer brand. The decision maker in healthcare is Wendy, 35-year-old mother of two, basically, who runs the family health decision maker, not only for herself, but her husband and her children. Target, the department store, has the same sort of customer set. So we look a lot at what they do, or at least I look at what they do and how they do it and think about how that might translate into our space. But that ad was about the convenience that our tools offer Wendy as she lives her life and her family lives their life. And it really struck a chord. Again, we didn't do this because we had a lot of things to sell to consumers, because, again, 90% of our business is still wholesale at this point. We did this because we wanted to begin to position the brand with consumers, and more importantly, we wanted to let our members know, our Wendy's know, that we care about them. We have tools and information and services that serve her needs and are designed to make her life work better. So the ads really did resonate. This next ad is designed simply to position us, as I mentioned earlier, with it sort of a new group, urban professionals, in a new way, which is with our transparency tools and getting people to think and act like consumers. And we call this Joe. Let's see if Joe's going to work here.
Joe here likes saving money. That's why Joe likes Aetna's payment estimator. He gets to compare out-of-pocket healthcare costs before they come out of his pocket.
That's awesome.
Now let's say every Joe in America uses it. Looks like everyone likes saving money. Ah, the potential of putting people first. Thanks, Joe. No more, get better. Get a smarter health plan. Aetna.com.
Joe's Wiggle got great reviews. But, so, again, that's the member payment estimator, which is unique in our industry. It's the best application we have, or the most complicated. Is it the one that members care about the most or want to use? No. They love the mobile app so they can get into their plan and find out what their, where they stand with their HSA or whatever. But, we're learning as we go along. And so, we kind of did things backwards. I said it was a preemptive strike. That's the second sale, if you think about it. The first sale is selling to Fidelity, the benefits manager, getting them to buy Aetna. The second sale is getting the Fidelity employee to choose the Aetna plan against United or Cigna or whoever else they have to choose from. So we sort of went at it backwards. We're kind of getting the sequence right now. Last week, we launched a new ad campaign, and I don't know if we have the Journal today, but we've got a full-page ad in the Journal. I think it's that ad there with the guy in the yellow or the orange vest. We've launched a new ad campaign that is designed for our first sale, the B2B sale, but it's meant to work very closely with this campaign, and we'll come back in the fall with another version of this. But we're pushing the boat out. We're getting more aggressive and more assertive in the B2B and the direct-to-consumer space to position the brand as the brand that's most capable of helping people think and act like consumers in healthcare and providing the tools and information they need to do so. And we think that's a big place in the market, big opportunity in the market, and it's a social need as well. And as we have, these are the digital ads that ran off of the campaign, the banner ads. We also have, if I can get through this, we talked about the personal health record. increasing brand relevance, we have a surround sound campaign. That this was the B2C campaign that we ran in the fall. We had radio, television, online ads. We used all of our Aetna channels, the online channels, and the business-to-business campaign that is launching. The dates are wrong there, but we're launching the B2B campaign this past week. All aimed at why Aetna. And again, we have brokers and consultants. I mentioned that about 90% of our business is B2B, and about 70% of that comes through brokers. So we have a pretty straightforward approach to distribution on that side. And the campaign theme is Smarter is Healthy. And smarter is lowering health care costs, not expectations. The point there is that consumer-directed health plans, these tools, these information, the services that we have to provide our members, again, helps them think and act like consumers, saves the plan sponsor money, and ultimately saves the consumer money. And it's believe me, it's an educational process to get people to, understand that, accept it, believe it, you name it, and to use the plans in that way. And I think people are getting it now after years of sort of pushing against health insurance, as controlling my access to my doctor, controlling the choices I make. What we realized is if we make those choices transparent and we make the costs and the implications of those choices transparent to our members, of course they make the right decision, right? They're not going to waste their employer's money or their own money. In my mind, it was our shortcoming all these years that we didn't provide this information to members. So the campaign drives our consumer-directed health plans, which are, very highly rated within the industry, mainly because of the support we give people behind them. And we're still driving the utilization of the tools, the mobile applications, which have been very well received. We've got an entire digital campaign in support of it, driving people to the website where we have a lot of the information they need. This is pretty cool. I've always wanted to do a big Grand Central splash, and we've Belinda and Arnold have figured out how to get us in there. We have, when does that start? Next week? This week?
Yes, part of it starts in March, and most of it will be throughout April.
Okay. So we've got, we will sort of slowly walk our way into Grand Central, and then we'll end up with a pretty dominating presence in March with our digital ad campaign. The interesting thing here is that we have a very high concentration of members in New England and the tri-state area, Connecticut, New Jersey, and New York, and in Pennsylvania. But a significant percentage of our members and the plan sponsors, decision makers, go through Grand Central. And of course, it's always a great way to get your brand to register on people. I'll just close with this and then take any questions anyone has. I didn't talk much about health reform, probably because I'm sick of talking about it, but and I'm sure you're sick of reading and hearing about it. But we've talked a lot about our transition as a brand from B2B to direct-to-consumer, and health reform will drive a lot of that. One of the biggest problems we have in this country, and it contributes to the fact that health care is so expensive and health insurance is so expensive, is the fact that we have so many uninsured people. It makes no sense for a society as wealthy as ours to have that problem. The Obama health reform plan does address access, doesn't address cost and quality, and that's another huge issue that we're going to have to deal with, because effectively we're putting a lot of people into a broken system at taxpayer expense. But be that as it may, one of the biggest problems we have in this country is because so many people are uninsured, those of you who have insurance pay a lot more. Medicare pays about 80 cents on the dollar, Medicaid pays about 68 cents on the dollar, and of course those who are uninsured pay very little, if anything. So what does that mean? That means that if you walk into a hospital or a doctor's office with an insurance card, you're paying more like 120, 140%. That's the way the system works. People get the care they need, they go to emergency rooms. That's very inefficient, expensive. It doesn't work the way it's structured. So Obamacare is the first big step towards solving that problem by providing access to insurance for about 33 million people will come into the insurance market. And for the most part, through the individual market, which was badly in need of reform. It was very dysfunctional because of the way the system worked. Only people who were healthy could get insurance, and those who weren't healthy had to pay an extraordinary amount for it. So the reform is meant to resolve those situations, and we'll see over the next few years how it works. But that's one of the main reasons we want to reposition our brand, because as more and more people, whether they get a government subsidy or just have to respect the law, the mandate, individual mandate, and buy insurance, and you've been through it in Massachusetts, you saw how it worked here. People will go to the private market. They'd rather buy through the private market. And we have a great brand. People know the brand, respect the brand. The question is it right for me? Is the right insurance company for me? So that's got a lot to do, has a lot to do with why we've been making these investments. And it really is a once-in-a-lifetime chance to transform a very highly regarded, well-respected brand, and all of us are working on it, having a blast. We're very, persuaded that the brand is the experience. Those word of mouth is going to have a lot to do with the choices people make in the new insurance market. They're going to ask their sister, their brother-in-law, who do you have, who do you trust, who do you have a good relationship with, and the experience they have when they go to our website, when they make that first choice, when they look at their options, and the experience they have when they call our nurses or our 800 number, it's basically going to set the tone for that relationship. Remember earlier I said that because someone else chose your insurance other than you, there was always that gap. Well, that gap's closing rapidly on the B2B side, and it's not going to exist on the D2C side. And reinventing the brand experience and putting the power of health in the hands of consumers is a huge opportunity for us. It's transformational in our industry. It hasn't happened. It's been headed in that direction, but we're pushing it harder. And we think by taking our brand and giving consumers the tools and information and support they need, and thinking from their perspective, how should these products work? How should these plans work? How should the web experience work for them? We think we'll be successful. So with that, happy to take any questions. Sir.
How are you bringing your sales channel, the broker sales channel, up to speed with what you're doing directly with the sponsors and the system?
Yeah, it's a great question. I mentioned earlier how dependent we are on the brokers for distribution, and that's changing rapidly because, obviously, how many of you have at least looked at the Massachusetts Exchange for insurance? Well, since you all have it, probably very few, but what happened in that, basically, when the mandate was put in place, everyone had to go buy insurance. And people go into the exchange, they think, oh, this isn't the experience for me, and they'll go buy in the private market. We expect that to happen. So it's going to be a question of how do we get those people to come to our site and to transact with us. Part of it is the advertising campaign and having the best site and the most easily navigated site and the most compelling brand, and the products priced at the right point. But also is appeal to our broker, our distribution network, because the brokers are dominant in this space. This is a very expensive, very complicated product. Now think about this. If you bought I have a wife and 2 children. So I don't even know what my insurance costs actually, but my guess is it's around $20,000 a year, all in. $20,000 a year. Think about that for a minute. Okay, that's more. I could buy a new Mercedes every year and have my monthly payments wouldn't amount to that. So if people actually thought about how expensive this product was and how much was coming out of their pocket, they'd act differently about it. But as of now, because it's so expensive and so complicated, most people choose to go through a broker. So at the same time, brokers are going through a lot. One of the complexities of the health reform law is that there is a minimum loss ratio requirement on health insurance. So what we've chosen to do is separate the broker commission out from that and have it be transparent, which actually is a good thing, regardless of reform, so that Fidelity or anyone else who uses a broker or consultant can just negotiate directly with that broker on what that commission is. We'll still collect it, but so the answer is it's a complicated world, and we've been pushing very aggressively with our brokers all of our messages and positioning. We've overhauled our broker website. We've created a whole set of marketing tools for them, and we've been driving through it. We're launching a new campaign actually next week with brokers. So they love this stuff because brokers not only sell the product for us, but in the small group market, small businesses for people with 100 or fewer employees, we have tens of thousands of those companies as members. We don't have the people to deal with them individually. So the broker actually ends up being the Aetna representative, not only on the sales side, but they help them. They basically help them with enrollment and picking plans. So they really do depend on us for this information flow. So we've been giving it to them. Yes, sir.
It's interesting that your example you gave was at a place where a person touches the most expensive part of the healthcare system,
Right.
which is the hospital, right? And so,
Right.
but what are you doing to educate, say, doctors? Because if my doctor tells me to go to Chinese,
Right.
I'm going.
Right.
You
Right.
know? So
Right.
it's like, yeah, I mean, it's not so much the consumer that's
Right.
in control, it's the medical system that's in control.
It's, yeah, you're exactly right. I mean, the problem, again, with the health system as it is today is my employer pays for my insurance, in my mind, even though it's actually out of my pocket. The doctor gets paid by Aetna, or the hospital that the doctor's affiliated with. The hospital collects something. There's this huge complex mix, and there's no transparency or no actual negotiated contract between you as the patient, your doctor, and your hospital. We're the middleman, and we try to make it work. And so what we've concluded is the consumer is a huge piece of it, but you're absolutely right. So is the hospital, and so is the doctor. Now, with the hospitals, we contract. So if an Aetna member goes in, we want them to have this experience, we want them to be charged this, and we negotiate. Doesn't always work out the exact right way, but that's one way of doing it. But we just bought a company called Medicity that specializes in software and tools for physicians and hospitals. And we're building an app store for doctors and hospitals. Because one of the biggest problems with the healthcare system is the technology is pathetic. I mean, people wander around with shoeboxes full of information, and you go from one end of a hospital to another, and there's no coordination of care. So we're creating apps for them to download that they'll be able to coordinate our members' care or anyone else they serve and share the information electronically. And at the end of the day, if we can get doctors and hospitals and the patient to all be working on the same information and have that kind of transparency, then we can get to the right place. There is an element of the reform legislation that wants to create an entirely new system of compensation for hospitals called accountable care organizations, and you've probably heard a little bit about them. And a lot of the Boston area hospitals are moving in that direction. That's basically where the hospitals are going to have to take risk for the care and the quality and the outcome of the care, instead of just charging by procedure. So if you go in and you have a surgical procedure, they're on the hook. If you come back with an infection, they're not going to get paid. So they have to manage your care effectively, which is a good thing. They're going to have to do it at a reasonable price, a negotiated price. And we're part of that equation, the hospital, the doctor, and the patient. So hopefully technology, health information technology, is going to get this stuff to work better. But again, the healthcare system compared to retail or financial services is in the dark ages with respect to technology. And I think a lot of people are going to make a lot of money in this town and other towns and across the street there creating software and other technology applications for doctors and hospitals to help them manage care.
Only other place you could go is dental.
Yeah.
Because dental's where, I think I feel ripped off every time.
But in dental, you're more used to thinking about it as coming out of your pocket.
You do.
And it's much more transparent. You think, you're going to charge me $1,200 for a crown? What are you kidding me? So people negotiate with their dentists, and people choose dentists based on what they might charge. And it's much more of a consumer marketplace than the rest of the medical system. And this is tough stuff. And we don't want people to be lying on a gurney in an emergency room with a serious medical crisis worried about what it's going to cost them. That's our job. But we do want people who are going to get an MRI or a colonoscopy or looking at a set of procedures and making an intelligent, informed consumer decision. That just hasn't happened in healthcare, and we think that it will, and it will become part of the way people basically live their lives. Yeah.
Is the health care, was that a conscious decision on your guys' part or with Arnold to separate those as two separate words and
Yeah.
then call out the care
Yeah.
side of it?
Yeah. I probably. I mean, who knows how these decisions get made? But we decided early on. In fact, when we did our agency search, you know, and Arnold descended from the clouds, and we chose them. We had no real choice, of course. But when we were looking at the other agencies, several of them came in with a whole positioning based around thought leadership and health reform, and I just said, absolutely not. You know, I'm sick of it. I'm sure you're sick of it. I don't think anybody's going to choose their insurance plan based on the reform discussion. Maybe some will, and we worked really hard to be a thought leader in health reform. Ron Williams, our chairman and CEO, was out there. He was the most visible person in the industry calling for coverage for everyone. We really pushed that hard, but to me that's completely separate than the brand and the, you know, actually selling products and services. So, you know, the positioning about smarter, and it's a little tricky, and we've been working on this, because if I told a group of people in this room, you know, you need to be smarter about how you consume healthcare, you'd be offended, right? What you want is for us to be smarter and have a smarter health plan, smarter tools and services, smarter plan design so you can get what you need. And that's what the position is about.
I applaud everything you're doing, putting the consumer at the center and people who use it at the center. And all things around it, I think, are great movements in the industry. I'm still struck by that the value that you've communicated is a financial sort of transaction value rather than health value.
Right.
You know, and maybe it's because of the situation we're in now and everybody is cost conscious, but when will it be smarter about your health, not smarter about the way you spend your money?
Right. That's a great point, and I would say part of that is maybe my mindset this morning. Part of it is the B2B campaign we're launching this week is aimed at the payer, at the plan sponsor who is struggling mightily right now to afford health insurance for their employees. Part of it is the fact that the system needs to change. But if you look at the, you know, Joe and the Wendy ads, and you look at what we're doing on our website and with the tools and services, it's much more about the experience, and it's much more about getting the right health care and quality health care, because there's nothing more expensive than the wrong procedure or a botched procedure. And so from our perspective, we have 38 million members, 38 million people whose health care we're responsible for. That is, you're right, that's our first priority. But nobody's going to hire Aetna unless they think Aetna can help them save money and get a better deal from the healthcare system.
So what's the center of your brand promise now? What's the unique, other than the user?
Putting the power of health in your hands. It's giving you the ability to make the decisions and to make the choices informed that you need to make. It's always been the other way around. The power of health's always been in someone else's hands, not yours.
To Aetna versus anyone else who could assume that?
It's a great question. We're just going to have to run harder and faster. Because one of the horrible things about our industry is everybody copies everybody else. And we think they all copy us. You know, that's because we have that singular point of view. But CDHPs, we created the first CDHPs. Everyone created CDHPs. We created a new ad campaign several years ago. Everyone basically copied it. We did the mobile payment estimator, the member payment estimator. People started copying it. I don't expect that United and Cigna and WellPoint and the Blues won't try and do exactly what we're trying to do. I'm sure they will. We just have to do it better and run harder and faster. And again, if our brand is about putting the power of health in your hands, the power to manage your health and wellness, the power to make the decisions you want to make, and the power to choose the plans that make sense for you, that's completely different than the way it is today. Now, everyone in this room takes their health seriously. Everyone. It's just that in this dimension, when you go to a hospital, go to a doctor, have a procedure, you haven't up until now known much about that. So of course you trust your doctor. Of course you do what your doctor tells you to do, and you should. But if you have that transparency, if you have that information, if you have that tool convenient in your hands, then you'll at least, when you can and when it's appropriate, act like a consumer, think and act like a consumer. When it's not, and you're a patient, and you just need to make sure that you're listening to your doctor and doing what you're supposed to do, we help on that side as well. We have 24-hour nurse lines. We have all kinds of online tools that help people answer questions they have before they have a procedure. And we have a real intense approach to managing disease states or chronic illnesses or surgical procedures for people. And that's a big part of what we emphasize in the ad campaign as well. Yeah. Great question. I would say there's two different things. There's the consumer campaign and the B2B campaign. B2B campaign is pretty straightforward. Does the phone ring? Do we sell more plans? Do the brokers and consultants call? Do we get on RFP lists on the consumer side, it's much more complex, obviously, because as I mentioned, we're putting ourselves out there in advance of the sale. So there's two dimensions. One is the simpler one to measure is what we call the second sale. So the first sale, again, is Fidelity choosing Aetna or offering Aetna insurance to their employees. The second sale is the Fidelity employee choosing the Aetna plan. So the consumer campaign can drive that, and we can see that. The more complex metrics that aren't associated with a sale, like people visiting the website, clicking through, looking at the tools and trying the tools, looking at the information, those are our proxies for now that we'll be driving. And then, of course, their feelings about the brand and whether they think the Aetna brand is for them, and the products and tools and services we create meet their needs. And we'll just measure that through research until we get to the point where we are actually transacting directly with consumers at a large scale. Yes?
Beyond the advertisements, how are you communicating with the vendors, moms, and we know that they spend a lot of time on Facebook and Twitter, that
Right.
they're very comfortable online.
Right. Yeah, we have a whole digital media campaign, not only advertising on those sites, but we've created a whole suite of tools that are on our website that we think are cutting edge. Not only the payment estimator, but Smart Source, which those of you who have Aetna should go check it out. It's a search engine that's linked into your specific plan, and it knows what your issues are and can help you find your way through the healthcare system, which people really need help on. But we also have a lot of we have the Aetna Foundation, which is a leading sort of philanthropic investor in a lot of areas of health and wellness that matter to people. And we're really, that helps drive the brand. We have a big community relations function where we're also working in communities. We're a leader in addressing racial and ethnic disparities in healthcare. We're a leader in advancing knowledge about childhood obesity that leads to serious chronic diseases like diabetes. And we're a leader on the policy side, and we think those things are good for the brand and good for our reputation and relationships, but again, that's separate from the sale.
And you have like online forums and communities.
Yep. Yeah. Yeah, absolutely. And we're just getting our feet wet with some of that stuff. And I expect over the next few years you'll see a lot more of that from us. A lot more about how we engage with our members or let them engage with each other inside the Aetna experience or the Aetna walls. Yes?
I'm like excited for now. You guys, we're going to talk this morning. By the way, the slides are gorgeous.
Yeah. We didn't do that one. That's pretty cool.
So you talked a lot about engagement. Engagement was a theme that was
Right.
running throughout the entire talk.
Right.
Larry says you're building this new CRM program. I'm curious where social falls out of the program.
Yeah. It's a big part of it, and as I just mentioned, we're sort of pushing ourselves into that slowly. You have to be careful because there is nothing more sacrosanct than your health information, your personal health information. We have it, you have access to it, you can share it with people if you want. But I think people, given it's their personal health information, it's a little different than other areas of social media. So and plus we're highly regulated with respect to health information and privacy and security. But we are starting to push the boat out there and figure out, how can we use social media to have members communicate with each other and lean on each other in a situation. So, mothers with diabetic teenage daughters, how can they communicate? How How can they share information and support? So we're thinking of all those things, and we're experimenting with some stuff. We've got, pretty significant element of our ad campaign is in the social media front and becoming more significant. But, I would say we are probably slightly more cautious than most brands in this space for regulatory and legal reasons, but also the fact that, we don't want to make a big mistake early on. So we've been pretty cautious, maybe more than we needed to be, but we're starting to get there. Yes, ma'am. I'd say yes and no. Some of them have been aggressive in some areas, and do a lot of some have done some really great ad campaigns on YouTube. But that's not what you're talking about. I mean, anybody can do that, and we do that. But I don't know that anybody's really pushing the envelope. It's a unique space in that we have all this information. People expect us to protect it. It's up to them to decide who to share it with and under what circumstances. So we try and put that control, in people's hands and let them make those decisions. But it's clear to me that there will be a huge opportunity for people in the social environment to share support data. Yeah.
You briefly mentioned leveraging data for proactive and predictive marketing.
Mm-hmm.
Just a little bit more how you do that and how you address it.
Yeah, I'd say that right now we're at the beginning stages since we're building the platform. But you can fast forward and see us deciding, if we want to market. The healthcare marketplace is bizarre. And I don't mean that like the Turkish bazaar, but maybe. It's very localized, right? And it's very segmented. So we might decide, all right, we want to sell this particular product. We want to attract this particular customer. 28-year-old healthy males in Austin, Texas, right? So a certain product at a certain price with certain plan design gets sold there. Whereas if you're okay, we need a product for 50-year-olds with children, one of whom has with health issues. Because guess what? When you're 50 and you have kids, people go to the doctor in the hospital. So we have a different product at different price point for a different marketplace with different plan design and different networks. So it's a complex business, and our CRM has to be able to adjust for all those variables all the time. And in the individual market right now, we underwrite, which is one of the reasons health insurance is so expensive in the individual market. The reform gets rid of underwriting, so anybody can come in and buy insurance. And when you're in that situation, you need to know how to price and what product features and attributes to build in and at what price so that you don't get put out of business. Okay, one more. Yeah.
As you move toward the brand promise and more of kind of a shared decision-making model, how do you keep a handle on what role doctors want you to play?
Yeah.
I imagine that's a pretty
it is. Doctors, it's a complex relationship. At times there's tension, at times there's not. I think doctors, generally speaking, want their patients to have health insurance and have a simple experience in their office or in the system. But from the doctor's perspective, unfortunately, doctors don't make the kind of money they used to make, and a lot of the money they make gets spent on administrative systems and keeping up with 6 health plans and Medicare and office systems and buying whatever technology they need to buy. So doctors aren't very happy campers right now. And I think that one of the best things we can do for doctors is to simplify their experience with us and simplify their dealings with us. So my view is if a patient asks a doctor, I've got to buy some health insurance, who should I buy? I'd love for them to say Aetna. They pay me on time, they've got the easiest administrative systems, their plans cover the right things, and their customer experience is good or their service is good. And so we are actively, intently working on our relationship with physicians because they take care of our members, because we have to pay them what we believe is a fair price and we negotiate that, but also because, word of mouth, my guess is doctors are going to have a lot to do with who people choose in the future. So with that, thank you very much, and thanks. Good luck with that.